Hello, I'm Dr. Jack McDonough, Chairman of the Advisory Board of the Henry R. Winkler Center for the History of the Health Professions at the University of Cincinnati College of Medicine. The Winkler Center is a medical archive, library, and exhibits gallery that encourages visitors and researchers to explore and examine the Cincinnati area's rich medical history and discover the people who have contributed to important advances in the medicine, nursing, and the pharmaceutical sciences. One of our real gems is the collection of the video oral history series. The histories and stories that we have collected from many of these remarkable pioneers are fascinating. We wonder sometimes how they made their discoveries, what pushed them to become leaders in their fields, and even what their lives were like outside their offices and laboratories. Today, we're going to interview Dr. John Wulsin. Dr. Wulsin is a professor emeritus in the Department of Surgery of the UC College of Medicine. Born and raised here in Cincinnati, he spent the first 7 grades at Cincinnati Country Day School and completed his secondary education at schools in Switzerland and Rhode Island. After 3 years at Harvard College, he entered medical school at the University of Rochester in the fall of 1941, several months prior to Pearl Harbor. Following internship at Strong Memorial Hospital, he went on active duty with the U.S. Navy in the South Pacific. A fellowship in pathology and anatomy at University of Rochester, a surgical residency at the Cincinnati General Hospital, and a second tour of active duty at the U.S. Naval Hospital, Yokosuka, Japan, during the Korean War, preceded his joining the faculty of the Department of Surgery here at the University of Cincinnati in 1955, where he remained to follow a career in academics and clinical surgery. He devoted 20 years of service to the admissions committee and 3 of these as the chairman of that committee during the height of the admissions boom in the mid-70s. He has also been very active in curriculum affairs over the last 25 years, and he was promoted to professor of surgery at UC in 1974 and a captain in the U.S. Naval Reserves in 1967. Taking part in this oral history of Dr. Wulsin is his son, Dr. Lawson Wulsin, a UC medical graduate of the class of 1978 and a professor in the Department of Psychiatry and Behavioral Neuroscience. Over the years, Dr. Wulsin has found great personal rewards in his many and varied teaching responsibilities and the clinical care of his patients. Let's join John as he talks about his experiences, his Navy career, and medical education. Good afternoon, and welcome to another in the oral history series of the Winkler Center for the History of the Health Professions. I'm Dr. Jack McDonough, and our guest today is Dr. John Wulsin, Professor Emeritus of Surgery here at the University of Cincinnati College of Medicine. And helping me out on this interview is his son, Lawson, who is a professor of psychiatry and neuroscience. John, you have had a long and productive career in surgery, research, and especially medical education.
Yes.
You were born in Cincinnati on May 28th, 1920.
Correct.
Which makes you 92 this year. And your father was a businessman, and your mother was a homemaker, and you had 3 brothers and 3 sisters.
That's correct.
You graduated from Harvard College in 1941.
Well, you know, I left Harvard College after 3 years.
Right.
And went to medical school.
Right.
And they would never give me a degree.
Oh, they wouldn't?
No.
Okay.
But they wanted my money. They
You
were
bet they
very
did.
happy to have that.
Well, after you graduated from, or left Harvard College, you came to the University of Rochester for medical school.
Yeah.
And graduated in 44. And
No, 40. Well, maybe it was.
Yeah. 44. And then you did your internship at Strong Memorial Hospital in Rochester.
Correct.
From 1945 to 1946, you were an active duty naval officer in the South Pacific on the LST-243,
Yeah,
and then on Island Command in the U.S. Marine Corps 5th Service Depot on Guam.
that's correct.
And Lawson knows a bit about that.
Well, my first memory of that was a helmet that you brought home from Guam that was hanging around the house. And I just remember you also met a painter, a Japanese painter, when you were on Guam, right?
Correct. He was, he had been on an island that the U.S. took over out in the Pacific, South Pacific. So he came directly from Japan.
Right. And then later, during the Korean War, you met up with him in Japan when we were
Well,
all there,
no,
right?
no. I met with him all in Second War.
But isn't he the one who painted that portrait of Mother?
Well, he might have, but that would have been well after
Later, yeah, right.
him
In Korea. Okay.
in Korea, yeah.
What were your duties there in Guam, John? Were you taking care of casualties or just doing surgery?
Yeah, I was in a we did know it was all outpatient.
Mm-hmm.
And so I was in a clinic, you might say, during the day.
And no surgery at that point?
Well, no, it was technically surgery, but I didn't do much.
Yeah.
You get kind of rusty after a tour like that, don't you?
Well, maybe,
Yeah.
maybe.
Well, after your naval service, you came back to Rochester for a one-year fellowship in pathology at the University of Rochester from 46 to 47.
Yeah,
And then you came back to Cincinnati to begin your surgical residency under the then chair Nolan Carter.
correct.
And you told me a few minutes ago that you actually knew Dr. Mont-Reed. How
Well,
did you know
yeah.
him?
Well, I knew him as a person. I wasn't working under him. But he was around, he was an important person in Cincinnati in those days. And I knew of him. I knew his wife better. She was a lady from Cincinnati whom he met here and married.
And he came from Boston, or not Boston, from Baltimore originally with Hoyer, didn't he?
Yeah, he did. He certainly did. That's correct.
And then Dr.
And so did Nick Carter.
Oh, that's right. Yeah. He was a medical student, though, wasn't he, when he came with
No.
Hoyer?
No, he was a
So
resident.
was he a resident as well?
Yeah, oh yeah.
Well, Nick Carter spent time in the War Department during the war, didn't he?
I think he did.
Okay.
Yes.
And when he came back in 46, I suppose, he relieved Max Zinninger, who was the interim chair.
Yes. After Dr. Reed died, Zinninger took over.
Mm-hmm. How was it working with Dr. Carter?
He was fine. He was rather distant and retired, but he was good.
His surgical skills were good?
Oh yes. Oh yes. I used to help in the operating room. He would help the residents do difficult cases.
Mm-hmm. And he did a lot of thoracic surgery, I believe, didn't
He
he?
did. Yes, he did. He certainly did, but not with the heart itself, but everything else.
Mm-hmm. And I asked you before, what do you think the reason was that he kind of suddenly and unexpectedly left the department in 1951?
I think he had something wrong with his heart. I don't remember for sure what it was.
Mm-hmm.
It was, and he had married a woman from Cincinnati, very well-to-do woman.
Mm-hmm.
Do you have that?
I have it in the files. Yeah, I
Yeah.
didn't put it in here.
Yeah.
And how was Max Zinninger? I understand he was a pretty good surgeon too.
Oh, excellent. He came with Dr. Carter and Dr. the one who went to Boston, to New York.
Hoyer?
Hoyer, yeah. They came from Hopkins all together.
Uh-huh. And Dr. Aldemeyer was a member of the department. He wasn't chair at that time, was he?
No. He went through medical school here, and then he went up to after medical school, he went up to
Detroit, didn't he?
yes, Detroit,
Uh-huh.
to the Hartford Hospital.
Uh-huh.
And he was there for 5 years, I think.
Okay, and he came back to Cincinnati
Yeah.
when you were a resident, or?
Yeah. He came back when either he came back during the war, so I probably wasn't a resident then.
And I think he was working on penicillin at that point, wasn't he?
I think so.
And so that's how he got a deferment because of
Yeah.
that.
Yeah, that's correct.
Well, then right in the middle or towards the end of your residency, the Navy called again.
Yeah,
And in 1953 and 54, you were back off to Japan, and Lawson has some questions about that.
oh yeah, that's correct. That's very true.
So there, you were stationed in Yokosuka, right?
Yeah,
And
in the Naval Hospital there.
right, and you'd finished your surgical residency by that point.
Oh yeah.
So you were doing the full range of surgical operations?
Yes, in the Department of Surgery.
Yeah.
In that hospital.
Right. And then every once in a while they'd send you off on a ship. Right?
Well,
Sometimes?
not really.
Mostly on land.
Yeah,
Right.
right there.
Right.
And when you were there, were you taking casualties from Korea, or was Korea
Yeah.
already?
No, from Korea.
Were you?
Yes, we were.
So that was really a general hospital then.
Oh, yes, completely.
Mhm.
Took everything. And I was in the Department of Surgery.
And you had to make a decision somewhere in the first few months there about whether we would stay home or whether we'd come and join you. Remember that?
No, I don't remember that. But naturally you would come.
All right.
After all, you were my resident, my family.
You're right. And so we came over, I think, after you'd been there about 3 or 4 months
That's correct.
and stayed for 2 years.
Yeah,
Yeah.
that's right. And by then, yeah, you came in and we stayed in a little town near the hospital.
Hayama.
Yes,
Yeah.
Hayama.
Yeah.
That's it. That's the trouble with my mind. I forget those things.
How demanding was it surgically? That work?
It was easy. Compared to Cincinnati,
Yeah.
it was a lot easier.
Yeah.
Now, when you came back to Cincinnati, I believe in '56, and completed the chief residency,
Yeah.
you joined the staff, but then you took time off and went back to the Massachusetts General Hospital and did a surgical fellowship?
Well, if that was, it was only for a couple of months,
Oh, was it?
couple of weeks or months. Yeah. By then, Altemeyer was head of the department.
Mm-hmm. And so then you really started getting active in teaching and patient care,
Yeah.
and especially your dedication to medical education and those 20 years in the College of Medicine's admission committee,
Yeah.
and 3 as chairman.
Well, whatever it was.
Wulsin?
Yeah. So, you remember giving this paper to the Cincinnati Academy of Medicine, I guess, in 1974, at the peak of this sort of rush of applications.
Oh, yeah.
And one of the sort of striking things that you were talking about in this talk was how the number of applications in 65 was about 1,500, and then in 2000 it was about, in 69 it was about 2,000, and then in 1974 it went over to up to 6,500.
Yeah, very quick.
On your watch.
Well, everywhere.
Everywhere, yeah, right, all over the country.
Throughout the country.
Yeah. So, you know, what did that mean for your daily life? I mean, how do you plow through all those applications?
You just did it. I just did that. And I do work in the operating room, too.
Sure. And in those days, I guess Ivy Dean was also helping out with the admissions committee.
Oh, yes.
Yeah.
She was running, and she still is
she still
now.
runs it, right.
Yeah.
But I think that there's never been such a growth spurt in interest
I don't
in
think.
applications. And you happened to be there at the time.
Yeah.
And he's making it sound awfully easy, but I know from experience, I was on the committee for 5 years.
Yeah.
It's very tiring. Did you have to interview all the candidates when they came through? They were doing that then, weren't they? You'd have to interview a bunch of them?
Yeah.
Yeah.
Well, not all of them, no.
Right, not all, but a lot.
Yeah.
But the other thing that you did that isn't done anymore is you went out looking for them.
Well, I used to go east.
You'd go to Boston and
Yeah.
Connecticut,
Yeah.
sometimes New York.
Yeah.
Yeah. And go to these major universities and set up shop and interview people all day long.
But another man from the dean's office here went with me.
You went to
What?
Harvard?
Yes, we
You
went.
interviewed at Harvard?
No, but we went to that place in east of here where Ohio State has a college.
You probably had the same experience where people you hardly knew would contact you and want you to help them get their children into medical school.
Yeah, that's correct.
And that could be pretty difficult.
Well, it was important. Yeah, it could be difficult. That's right.
Especially if they were friends of the family or something like that.
Yeah, sort of. That's right.
I remember when I got on the committee, Dr. Barrett called me up. I was just fresh out of the Navy, and he said, "Jack, we need you on the admissions committee." And I said, "Okay, how do I do that?" And he said, "We'll take care of it." And lo and behold, 2 years later, his daughter came up for consideration. So I had to recluse myself from that.
Yeah.
But during your years in the department, John, you worked with Max Zinninger, I'm
Yeah.
sure,
Oh, yeah.
and Dr. Aldemeyer.
Yeah.
And you actually did about 8 papers with Dr. Aldemeyer in your research, some of the research you did.
I wrote most of those papers.
Oh, I believe it. I believe it.
And he had his first name.
Oh, absolutely. I know the drill. Yeah.
Most of them were about surgically related infections.
Yeah,
Right?
that's correct. They were.
And this is in the 50s and early 60s. There weren't a lot of choices about antibiotics in those days, right?
Well, there were quite a few antibiotics.
You had penicillin and sulfa drugs.
Yeah, well, that's pretty good.
And then they had chloromycetin, I think.
Oh, yeah, chloromycetin. That's right.
I remember chloromycetin and carbowax was a big deal with Dr. Aldemeyer.
Yeah, that's right.
I don't know if that ever worked. The residents didn't think it did, but we did it anyway. And you got to work with Gene Stevenson.
Yes,
And how was Gene to work with? He's kind of quiet, wasn't he?
very quiet, but very good. Very slow in a sense compared to Max Zinninger. He was slow, but he was very thorough.
And very meticulous.
Yes, very meticulous.
His radical mastectomies would take sometimes 5 or 7 hours,
Yes.
like the true Halstedian technique.
That's right.
And Tell me, is it true that Dr. Hawksworth and Dr. Seiler used to get in fist fights?
I don't know. I wouldn't be surprised. They were co-residents together. Dr. Hawksworth tended to be a little bit compunctious. He liked to fight.
Yeah, he certainly was an interesting guy.
Yeah.
How did he get involved in blood banking, or do you know?
Well, here in Cincinnati. Cincinnati, blood banking started over at Children's Hospital. And Dr. Hawksworth got involved with it then. And then they tried to throw the surgeons out of the blood bank, but it didn't work. Hawksworth was around then, and that's what got him going.
Oh, yeah. I'd hate to have to argue with him.
That's right.
Yeah. I remember when I was a resident or intern, we used to go on rounds with Dr. Hawksworth, and the only patients we would show him were our complications. And I asked the chief resident, I say, why do we always call Dr. Hawksworth to see our complications? He says, because he's had all of them.
He was. He was a hard-going man.
Yeah. Great personality, though.
He was. Now, Seiler was very quiet, I mean, in a sense quiet, and a much easier person to work with. I much preferred to help Dr. Seiler than Dr. Hawksworth.
I'll bet. And didn't you published about 7 or 8 papers with Dr. Seiler, didn't you?
Probably.
Yeah.
Yeah.
Yeah, he had a number of papers, or you and he had a number of papers back in the 60s, I believe.
Yeah, that's correct.
Related to pancreatitis, primarily.
Yeah.
Right.
Yeah.
Now, was there a surgeon by the name of, was it Johnny Mack, or?
Well, there was a Mack, M-A-C-K, over at Children's Hospital.
Oh, okay.
I mean, at Jewish.
Jewish, okay.
And I forget his first name right now. I'd remember it if somebody brought it up to me. He was a good man.
I remember him on rounds when I was a medical student.
Yeah.
And I never met Marshall Lee, but he was a pediatric surgeon, wasn't he?
Yes, he was. He started here. He came here from where did he take his training? In the East somewhere. Anyway, Marshall Lee, he came here, and he was up at C4. But he did some work over at Children's, and he did some work here.
Oh, okay. And C4 was where the surgical offices were.
Exactly.
And,
yes.
And that was in one of the old, that was in C Pavilion for the people who don't know that.
On the top floor.
On the top floor. How did Dr. Seiler get the name Hoppy?
That was his name, middle name.
I thought it was Vinton E. Seiler.
Well, he was always called Hoppy.
Well, I think there was a German surgeon by the name of Hoppy, and I always wonder whether or not they called it after him.
I don't know. I never heard. I don't know where Hoppy came from. But I think even as a resident here, he was called Hoppy when he was a resident in surgery.
Oh, okay. I didn't realize that. And how were the politics in the department back then when you were on the staff? Was there a lot of political
There
things?
always is.
Do you remember any specific instances?
Well, you know, my memory isn't very good. It probably was more different then than it is now. But there were many fewer people.
Right.
My mind is not good, Jack. I'm sorry.
No, that's all right. That's all right.
What was it like collaborating with Altemeyer?
I just kept quiet.
He was not quiet, was he?
Not really, but he wasn't. You know, he would talk, but he was all right.
Uh-huh.
Somebody told me that when Dr. Altemeyer came back from Detroit,
Yeah.
he didn't feel that he was as good an operator as he should be, so he was taking cases away from the residents.
Well, that could be.
And, oh, that you don't know if that's true or not.
It probably is true.
Okay.
I don't remember it, but that probably is true.
Well, you know what they say about academic politics? They're so vicious because there's so little at stake. Well, you retired as a professor emeritus in 1985, I think you said.
Correct.
Okay.
Yeah, I was 65 then.
Did you continue to work on the college admissions test committee then?
I think I did for a little bit.
Did you?
Yeah, I don't remember, but I think I did.
Okay. Well, one of the questions I ask all of our interviewees, because I think each one of us has an answer to it, is there any one person or two persons that were mentors in your life? Somebody that really changed the course of your career? A teacher, a relative, or somebody like that that really put you off in a new direction?
Not really. That may have been more my fault than theirs. Because I didn't reach out to other people a lot. No, I would say there probably was, but I don't remember who it was.
Oh, okay. And what would you consider the highlight of your surgical career? Getting through it?
Yes.
No, I mean seriously.
Well, you know, I was 65 when they kicked me out, you might say. But I stayed on, and my wife had connection with the University of Cincinnati, so I stayed on. But I didn't do any surgery after 1985.
Okay.
You served on the Christ IRB for a while.
Yeah,
You'd go to those meetings.
yeah, I did. But I might have been on that even before I retired.
Yeah, right.
Well, John, you you married your wife Rosamond in 1942 while you were in medical school.
That's correct.
How did the two of you meet?
Well, that's funny. I'm trying to remember how we met. I don't, but I do remember after marriage, we had a little party at her house in Clifton. And a lot of older people came and showed up. And then around 6:30, we went off and spent our first night in Lexington, Kentucky.
Oh, okay.
Honeymooning in Tennessee.
Well, then later, yes. After that,
On gas rations.
that's correct, for only 4 or 5 days.
Right.
Then we came north, we came back up here and then went back to medical school.
Mm-hmm. And you had 5 children:
Yes,
John Jr., Lawson,
yeah,
Drawson,
yeah,
Rosamond, and Stockton.
correct.
And I understand you have 11 grandchildren.
More than that. I think it's 13 or 14.
Okay. And you have at least one grandchild, and I hear there's one on the way.
Great-grandchild.
Great-grandchild, I'm sorry.
Yeah.
And one on the way.
Well, yeah, the younger ones haven't married. I mean, they've married, but they haven't met children.
And unfortunately, Rosamond passed away in 2003.
Correct.
Okay. She was a lovely lady, by the way. I remember her very well.
Yeah, she was.
Charming. She was on the Board of Trustees of the University of Cincinnati, wasn't she?
She might well have been.
I think she was.
Yeah, yeah.
And then along came Anne, who you married in 2005.
Correct.
And the two of you currently spend part-time here in Cincinnati and part-time in Connecticut.
Yeah, she teaches still in Hartford, Connecticut.
Oh, okay. What does she teach?
Teaches
Oh,
kids.
just kids, okay, but in grade school or?
No, in college.
College, okay, great. And how did the two of you meet?
We met here in Cincinnati.
In Canada.
That was it,
That's
in
right.
Canada.
Right.
That's exactly it. Annie had a very good friend who used to come to Canada.
Right.
And so she came up there to be with her friend. And that's how I met her up there.
And the rest is history.
Still is. Yeah.
Well, John, is there anything else you'd like to talk about this afternoon?
I'm not a very good talker now.
Oh, come on, you're doing great.
Well, not really.
Okay. Wulsin, do you have any
Yeah.
other questions?
Well, so in the 50s, a general surgeon had to do lots of different stuff.
Yeah.
And one of the phases that I remember was all this endocrine surgery
Yeah.
that you did. And you know, we have these, a couple of sheets here on hyperparathyroidism and hyperthyroidism.
Yeah.
These slides. And then there's a couple of other publications that you did on pheochromocytoma.
Yeah,
And
that's right.
this one showing this excision of the pheochromocytoma
Yeah,
and its effect on blood pressure.
that's right.
How do you learn that stuff? I mean, these days,
You learn it.
do general surgeons still do that? Or is that even more specialized?
I don't know what they do now.
But how did you learn it?
Just up here.
So endocrine surgery was one of the themes, and then breast cancer
Yeah.
surgery was another
Yeah, that's
theme,
correct.
right?
Yes.
Yeah, I remember when I was a resident, when we had difficult thyroid cases, we would always call your father in for consultation to
Yeah.
help us try to figure it out.
Yes.
And there were a number of articles about breast cancer.
Yeah.
And then there was your only brush with fame came with this Time magazine article in 1972. Remember this?
No, not offhand. I don't remember it.
Monday, February 14th, 1972. The Nation. Cooper's Droop.
Oh, they stole
They stole.
Stole it.
Yeah. How did that happen?
Oh, it wasn't anything important.
It was in the JMA Journal,
Yeah.
wasn't it?
Yeah, something
Yeah.
like that.
Right.
But
You were responding to somebody's question about whether bralessness would
Yeah.
affect the anatomy,
yes.
right?
Yeah, and exactly. But I don't think it did.
Well, you got your 15 minutes of fame out of it.
Yeah, right.
Well, I guess that's about all.
I remember that. That was quite the talk down here at the College of Medicine when that came out.
Racy John Wulsin.
Exactly, right. Yeah.
Talking about the braless
Yeah.
movement.
That's right. Everybody was shocked.
Right. Yeah. It made going to parties a little awkward, didn't it, for a little while?
No,
No? Okay.
not really.
Yeah.
Well, anything else, Lawson?
I don't think so. Navy. Oh, just sort of Navy medicine. You kept going on Wednesday nights to the reserve
I did.
clinic here, right?
I did.
What was it that you liked about
The Navy
Navy medicine? Yeah.
I liked the Navy, and I liked medicine in the Navy. It was easy compared to here.
Yeah. Because this is mostly healthy young men?
I think so.
Yeah.
But even when it wasn't healthy young men,
Yeah.
older men with cancer or something like that. But no, I liked the Navy.
Well, there's a lot of collegiality, right?
Yes,
Yeah.
right. And one enjoyed getting to know people in various areas other than medicine.
Right. And you were promoted to captain in 1967.
Yes, it was.
And that was your final. That was your final rank.
Yeah,
Uh-huh.
yeah.
Well, you beat me. I only got to lieutenant commander.
That's all right. You didn't miss anything.
I'm sure.
You liked the uniforms, but I think Mother liked them even more. You're doing her a favor by staying in the military.
I'm sure you look pretty dashing.
Yeah, right. Right.
Now, John, did you have any hobbies that you like to do? I think you were pretty active in the Camargo Hunt at one time, weren't you?
I was, yes. But you know, I was not a good athlete. I was strong. I could get along, but I was not a natural athlete.
Mm-hmm.
Except on a horse.
On a horse?
Naturally good rider.
Oh, that's
Right.
good.
Yeah,
Since he was 10.
Is that right?
Yeah.
yeah.
Now, were you master of the hunt at one point?
Yes,
That's what I thought.
yeah. I
But
was.
the other hobby that's relevant to his surgery is woodworking.
Yeah, I used to like to work in wood. That's right.
And would
I
you build
wasn't that- I
furniture
wasn't.
or what?
No, I
Yes.
wasn't that good, but I
But all
liked.
of us have bookshelves or benches that he's made.
Oh, perfect.
Yeah, small pieces of furniture, tables.
Uh-huh.
And his workshop is where he spent a lot of time.
Yeah, I could go down there and escape.
Escape, that's your
Everything,
refuge,
yeah.
right?
Yeah.
With 7 kids, I don't blame you.
I had 7 brothers and sisters, 6 brothers and sisters,
Right.
Uh-huh.
5 kids. Right.
but 5 kids.
Uh-huh. That's
Uh,
right.
He's number 2.
Uh-huh. Anything else?
I don't think so.
Okay, well, John, it's been a delight to have you here for our oral history program. And we really appreciate you and Lawson taking the time to be with us today, and for our viewers to be with us today. Thank you very much.